Hi, Don Reardon from the Mulligan Concept Teachers Association. Just with a few factors to keep in consideration relative to the mobilizations with movement that are used in Sue Reid's article. For supination, what we're going to do is we're going to test it manually to begin with to find out that we can actually, with mobilization with movement, turn off the pain and restore the motion. So with my thumbs over the ulna overlapped and my fingers on the radius overlapped, I am going to apply the forces to that joint, and then the patient is going to actively supinate with passive overpressure. Now, many of the patients will reach up onto the hand to give overpressure. You need to make sure that they stay on the forearm. For a self-mobilization with movement, the advice part of the article, I want you to reach all the way around with your fingers onto the ventral part of the radius, and your thenar eminence is pushing up on the ulna. At the same time you do that, if you can now actively supinate with passive overpressure, that's the way, as long as the pain is gone and it's just a feeling of stretch, that's fine. Okay, for flexion extension, we're going to make sure that your web space is on the medial aspect of the carpal bones, and all we're doing with our other web space is providing a counter force on the radius. So if I apply a lateral force or a radial force with the carpal bones and a medial force, comparatively similar force on the radius, there is going to be a lateral glide of the carpals on the distal radius and ulna. Go ahead and extend your wrist and flex your wrist. I can go either into flexion or extension. And again, if it's pain-free, if it's not pain-free, I'm going to search for the direction. I might need to change my angle ever so slightly or add an actual rotation. Go ahead and extend with a little bit of rotation, and then there's overpressure if it's symptom-free. To progress into a weight-bearing posture, go ahead and stand up. And I can now find manually the position to provide the glide here. And if I stand behind him, go ahead and come forward. I can actually provide a little overpressure once I find the glide with my shoulder on underneath his upper arm. Okay. Once I find manually the position to perform this in, we can use a strap. There you go. And that's what Sue did in her article, was to show the patient how to perform the same type of mobilization with movement with the strap. He's going to provide a lateral force or a radial force on the carpal bones. So, and then once he finds the correct position to go in, he can now go into overpressure, passive range of motion with overpressure just by moving his body. If he needs to alter the angle of this just slightly, he can do so. And those would be the factors that I wanted you to consider when applying mobilization with movement to the wrist. And I look forward to seeing you in the course to learn more about these.